Dear friends, colleagues and partners, I am pleased to virtually join the 70th TRAC Annual TB Research Conference and World TB Day commemoration in Ethiopia. As we come together to commemorate World Tuberculosis Day, we stand in solidarity with the millions of people who fall ill with TB each year, and we pay tribute to the millions who have lost their lives from this preventable and curable disease. We would like to salute all the health workers at the forefront of the fight to end TB and other diseases, including communities, civil society, and advocates, national TB programs, partners and donors for their tireless dedication and support to the fight to end TB. TB remains one of the world's deadliest infectious killers. Each day, close to 4,400 people lose their lives to TB, and close to 30,000 people fall ill with this preventable and curable disease. While global efforts to combat TB have saved an estimated 74 million lives since the year 2000, the COVID-19 pandemic, coupled with the conflict, other crises, and socioeconomic inequities, has reversed years of progress made in the fight to end TB. This has placed an even heavier burden on those affected, especially the most vulnerable. For the first time in over a decade, WHO reported that estimated TB incidence and death have increased. Actions and investments still fall far short of those needed to end the TB epidemic. 2023 is a pivotal year to push forward the agenda towards ending TB, as there are several high-level opportunities to raise visibility, increase political commitment, and enhance investments for the TB response. The theme of World TB Day 2023, Yes, We Can End TB, reflects this and aims to inspire hope and encourage high-level leadership, increase investments, faster uptake of new WHO recommendations, adoption of innovations, accelerated action, and multi-sectoral collaboration to combat the TB epidemic. On World TB Day, WHO is calling for action on several fronts to ensure that the commitments made to end TB are achieved. First, we would like to call for high-level leadership and advocacy. Heads of states will come together to deliberate on accelerating efforts to end TB for the second time at the 2023 UN High-Level Meeting on TB at the General Assembly in September. The prioritization of TB in the agenda of heads of states and other leaders provides strong impetus on step-up progress against this ancient disease. 2 other UN high-level meetings will be held at the same time, focusing on universal health coverage and pandemic preparedness and response. There are clear linkages between the agendas of ending tuberculosis, UHC, and pandemic preparedness and response, and these linkages will raise the visibility of tuberculosis and possibly attract greater funding in the current pandemic context. We urge highest-level participation and civil society engagement in the UN high-level meetings. WHO's Director General is announcing this month the expanded term and focus of his flagship initiative for 2023-2027. The initiative will bring together countries and stakeholders to redouble efforts to ensure universal access for prevention and care and the latest tools and technologies to combat TB on the road to universal health coverage. Second, we are calling for an urgent increase in domestic and international investments to close critical funding gaps to ensure universal access to TB prevention and care, as well as for research. More investments towards supporting the rollout of WHO-recommended TB preventive treatment options, shorter TB treatment regimens, rapid molecular diagnostics and tests for TB infection, and other innovations and digital tools will lead to improvements in health outcomes and save millions of lives. Importantly, investments in research and innovation are vital to fast-track efforts to reach the end TB targets. In particular, WHO is building on lessons learned during the COVID-19 pandemic and linked platforms to advance research on new TB vaccines. A new TB Vaccine Accelerator Council was announced by the WHO Director General in January this year to facilitate the licensing and use of effective novel tuberculosis vaccines, catalyzing strategic alignment between funders, global agencies, governments, and end users in identifying and overcoming barriers to vaccine development. Third, we are calling on governments and other stakeholders to accelerate the implementation of the latest WHO guidance and rapidly roll out new tools to benefit those ill with TB. WHO is issuing a call to action on World TB Day with partners, urging member states to accelerate the rollout of new WHO-recommended shorter all-oral treatment regimens for drug-resistant TB. Fourth, we are putting the spotlight on the importance of tackling health inequalities to ensure health for all. People with TB are among the most marginalized and vulnerable, facing barriers in accessing care and stigma and discrimination. WHO is calling for global action to address health inequities for people with TB and other diseases. Fifth, ending TB requires concerted action by all sectors to provide the right services, support and enabling safe environment in the right place and at the right time. TB is mainly concentrated in settings beset by poverty and other social and economic challenges, and in the most vulnerable populations. Poverty, undernourishment, poor living and working conditions, among others, affect how people fall ill, develop TB, and cope with the demands of treatment, including medical, financial, and social, and influence the health outcomes they face. Thus, progress in combating TB and its drivers cannot be achieved by the health system alone. WHO is therefore calling for firm political commitment at the highest level, strong multi-sectoral collaboration beyond health, and an effective accountability system. All these actions can help fast-track the TB response, saving millions of lives. Dear friends, as we join forces this World TB Day with hopes for a brighter future world free of TB, we at WHO collectively recommit to keep the promises made to the millions affected by TB each year, despite any hardships, challenges, or crises that come our way. We cannot falter in our commitment till we reach and save every person, family, and community impacted by this deadly disease. No more excuses and delays in prioritizing and investing to end one of the world's top infectious killers. Together, yes, we can end TB. I wish you the very best for the conference and World TB Day commemoration.